Happy National Breastfeeding Week from us all at UCD, Nursing, Midwifery and Health Systems. During this short clip, the students and staff at UCD will take you through what normal newborn behaviour is in a breastfed baby. I hope you enjoy it.
Hi, my name is Aoife. Let's start talking about feeding cues in the early days of breastfeeding. Babies often give signals to show that they are ready to feed. It is helpful to recognise these early signs. These include rooting, sucking on their hands and turning their head. Crying is a late sign of hunger, so it is good to be aware and respond to these early feeding cues.
Next up is cluster feeding. One behaviour that can sometimes confuse parents is cluster feeding. This means that your baby wants to feed more frequently, and it's usually often in the evening times. It is totally normal, and it's just your body's way of producing the right amount of milk. Cluster feeding can last a few hours, and it does not mean that the baby isn't getting enough milk. It's just their way of making sure that they get what they want.
Frequent night waking is another common behaviour in newborn babies, and especially breastfed babies, as their stomachs are small and breast milk is easily digested. It is important to know that this is normal, and your baby's night waking is helping them to grow and develop. Having a good support system in place during this time can make a big difference.
Let's talk next about the importance of skin-to-skin contact and comfort. Skin-to-skin contact is incredibly important to the newborns, not just for feeding, but also for bonding and calming. Babies don't always suckle for food, but they often suckle for comfort as well. This helps them feel secure and can also aid in milk production. So if the baby wants to be close to their mothers, that's perfectly normal.
Another common concern for new parents is weight loss in the first few days. It is normal for breastfed babies to lose up to 10% of their birth weight in the first week of life. By 2 weeks, most babies regain that weight, and from then on, they should start to steadily gain weight. If parents are concerned about their baby's weight, it is a good idea to speak to the community midwife or the public health nurse. But remember that this early weight loss is a normal part of breastfeeding.
Another way of knowing that a baby is feeding well is by keeping track of their nappies. In the first days, the baby's stool is thick and dark, called meconium. After a few days of breastfeeding, it will transition to a mustard yellow seedy stool. You can expect about 6 wet nappies a day after the first week. This will help new parents reassure that the baby is getting enough milk.
Babies have unpredictable sleep patterns. Breastfed babies tend to wake up more often than formula-fed babies because breast milk is digested faster. Newborns will sleep a lot during the day, but they also wake up frequently for feeds. Over time, as their stomachs grow, they can take in more milk at each feed. Their sleep will become more regular, but frequently waking is normal in the early months.
While all these behaviours we discussed here are normal, it is important to know when to seek help. If the baby is not having enough wet nappies, is very sleepy and not waking to feed, or if there is pain during breastfeeding, it is a good idea to reach out to the community support in your area, such as the community midwife, public health nurse, GP, and local breastfeeding groups such as Kiju and Lehesh League. Do not hesitate to ask for help. Breastfeeding is a learning process for both the mother and baby.
Thanks for listening, and happy National Breastfeeding Week from the School of Nursing, Midwifery and Health Systems here in UCD.